Good afternoon, everyone, and welcome back to the Systems and Sustainability Echo. My name's Andrea Roche. I'll be facilitating our conversation today. I just have a little bit of housekeeping before we get started with, it's going to be a really great session. I'm really excited for our conversation today. Just so you know, these sessions are enabled for live closed captioning if that helps you to join and attend. If you want to view that closed captioning, just navigate to the bottom of your Zoom window and select the Show Captions option. You might need to click on that three dots, that More menu in the bottom right corner of your Zoom screen to find it. If you're having any trouble accessing that, just message Carly with UT Echo IT or me and we'll help you out. As you saw when you joined, we are recording these sessions for later distribution through our YouTube channel. Know that any information you put in the chat is not shared on those recordings. As always, because there are a lot of us in this space, we do ask that you stay muted unless you're speaking, but we do encourage everyone to speak. If you're on the computer, just use the mute icon in the lower left of your screen. If you join by phone, it's *6. You can also use the chat to share your information, share your questions, share your challenges and your experiences. Just remember that whether you're speaking up or you're sharing information in the chat, no protected health information is allowed in either space in either area during the entire session. Speaking of that chat, we do appreciate your help in capturing just a full record of who's joining these sessions. So navigate over to that chat and enter your name, affiliation, and email so we know you're here. And I'd also ask that if you are a Be Well Texas provider, make sure you identify yourself during the session. And if you're joining by phone, make sure you email that phone number to bewelltx@uthsa. uthscsa.edu. We'll throw that email over into the chat. That's just so we know you're here. It helps us with our attendance keeping. Towards the end of the session, also keep an eye out on that chat. We'll send out a link to an evaluation survey you can fill out. We want you to fill these out to give some feedback on the program and also be entered into a drawing for a $30 Walmart gift card. Okay, I am really excited for our session today. We have a opening presentation on ways to gain referrals for existing organizations and opportunities for increasing funding. After that, we've got some announcements from the CSTAT team, and then we will hear a case presented and open up for conversation and feedback and discussion with all of you. As always, these sessions are what we make of them, so I encourage everyone to share your questions, your perspectives, your feedback, and your challenges in our case conversation today. We're all teachers and we're all learners in this space. So before we get into those didactics, I want to start with some introductions. Kathy, I'll start with you.
Good afternoon, everyone. I'm Kathy Hudgens. I am an LPC LMFT and I work in integrated care. I have built systems for SUD programs, for primary behavioral health programs, and I've been a teacher for pretty much of most of my career. And as Andrea said, I continue to be a learner, and I want, I'm also part of the Hub team. So thank you so much for being here, and we're super excited to hear what our presenter has to say today, and excited about the case.
Great, thank you, Kathy. Glad to have you on. Leslie.
Hey everybody, just like Kathy, I'm also a clinical consultant, and I'm also a clinical associate professor at Arizona State University. I have over 20 years of clinical experience, specifically within medical healthcare settings, providing behavioral health support, mental health, and substance use support. And so I really enjoy being here, learning from all of us as a community, and also providing recommendations and consultation. So I'm really looking forward to our speaker today, whoop whoop, and who's also an ASU alumni, and also being able to be part of making recommendations with a case later today. So thank you, everybody.
Terrific. And Andrea.
Hello, my name is Andrea Hadler, and I am the program coordinator for CSTAT. Welcome, everybody.
Thank you. And I see one of our presenters for today. Rita, would you mind unmuting and introducing yourself?
There we go. Good afternoon, everyone. Can everyone hear me?
Yes.
The typical Zoom question. Glad to be here today. I'm an RN case manager working in permanent supportive housing in Austin, Texas. I don't know if you all have access to the case form, but I basically provide intensive medical case management to single adult residents of our SRO properties, the majority of whom are coming out of homelessness and have a significant intersection of severe mental illness and substance use disorder that really impacts their physical health.
Great. Rita, thank you so much. We will look forward to that presentation a little bit later on in the session. Thank you so much for joining us. And last, I'll come to you, Dr. Komolafe. Introduce yourselves, and while you're doing that, we'll pull up the slides and then you can take it away.
Thank you so much, Andrea. I appreciate you having me here today. My name is Dr. Ronke Komolafe. I'm the CEO of Integrated Physical and Behavioral Health Alliance. We're a business management company that focuses on integrating care from a perspective of a payer, provider, patient, healthcare IT, and from a perspective of regulatory agencies. And today I'm really excited to be presenting and talking more about gaining referrals for existing organizations and increasing funding. We all know that substance disorder programs typically have the lowest funding when it comes to mental health or in healthcare in general. So this topic is very near and dear to my heart. So thank you all for having me here. Next slide, Carly. Before I continue, I would like to say thank you to UT Health and Andrea and her team for having me here once again. I really appreciate you having me here. And for the disclosure, all the speakers and all the members of the planning committee have no relevant financial relationship with a commercial interest to the disclosed or to be disclosed or to the topic that we are talking about today. Next slide. So let's talk more about what do we mean when we talk about substance use. I'm not going to go into detail about what substance use disorder is, because I'm very confident that everybody in this attending today really does know what substance use disorder means and the necessity of treating substance use disorder with mental health diagnosis, and especially collaborating with other inter agencies in order to ensure the members receive the best care. So when we talk about mental substance use disorder, I'm assuming as I go further into detail for today that we all know what that means. So let's go ahead to the next slide and talk more about the learning objectives. So for the learning objectives, today we'll be identifying opportunities for financial sustainability and growth of a substance use disorder program. We'll develop strategies and solutions for the financial sustainability of a substance use program. And then we'll talk about barriers to overcome for the growth and sustainability of a substance use disorder program. Next slide, please. So when you look on the screen, this just gives us characteristics of Medicaid enrollees with identified substance use disorder. Looking at this slide when I was doing my research and trying to find a slide that would really break down the detail of the substance use disorder by category, it was interesting and very shocking to me that alcohol disorder was one of the lowest. Not the lowest, but was really in the middle. I was expecting alcohol use disorder to be probably at the very top. But surprisingly, it's not, but it's probably a very common disorder that we often see, followed by opioid use disorder. Cannabis is becoming more rapidly seen due to the different laws across different states that talks about cannabis, use for recreational or medicinal use. And then of course we have stimulants that some people often abuse for their own use. And then we have other substance use disorders, just from a large perspective. But when we look at this, it's interesting that as time goes on, we're starting to see the use of substances become more prevalent starting from a younger age, usually 12 years old for most states. I know for the state of California, it's now their Medicaid organization, and their Medicaid system has now said individuals who are 11 years or older should now be screened for substance use treatment and interventions should be given to them if they screen positive. So we can see not just with Medicaid, but with even other payers that looking at substance use disorder in our children and in our youth has become very necessary, not just in adults. Next slide, please. So this slide really focuses again on the percentages and the use of the different types of drugs among individuals 12 and older. As we can see for this particular slide, when we talk about it in the use of lifetime, more people tend to use marijuana more than any other drug of choice, followed by cocaine, and then LSD, ecstasy, and then, we have the other ones in there. And the use of this really comes down to the abuse and the impact it has on our system and the ability for people to get help. Next slide. Often it's not just about the use of this substance, it's really the effect it has on individuals using it, the dependency and how it impacts their life. A lot of the substance use disorder programs we have there have a lot of funding challenges. Most of them depend on federal substance abuse block grants, Medicaid reimbursement, or different types of state funds. And on a global scale, this looks like a lot of money coming in, but in reality, that's not enough money to help sustain and truly manage these programs, especially with inflation going on, seeing a rise in staff workforce shortages. We need more revenue streams to help manage and sustain these programs. So what can we do to achieve that? What are the strategies we can take to truly achieve that? Because when you apply and get a federal grant, what are you going to do after the grant is over? A lot of times it falls on these organizations to continue these services. Medicaid reimbursement, as we know, is not the highest when it comes to substance use programs. And then, of course, the state's general funds just depends on what the 1115 waiver says or what the state has in terms of budgets. And next slide. So we look at the different challenges of substance use service delivery. The main and the most common challenge we'll see is low reimbursement rates. We talked about that earlier, how that affects service provision. And then, of course, we have staff shortages. If there's anyone here who has a secret to addressing the staff shortages in mental health or substance use, once we get to this discussion section, please feel free to bring it up. Of course, we have limited resources. Funding, which we'll talk about more in detail, is a big challenge for substance use service delivery. And then access to care. It feels since the pandemic and since we've seen an increase in SUD, the need for SUD services since the pandemic, that we continue to see more challenges when it comes to access to care. There's delayed to care. There are different services that we all want to provide, but we're having challenges to provide because of access. And access really comes down to staff shortages. And then we have insufficient capacity in our hospitals, which in some cases could be due to funding and resources. We have stigma, and then we have lack of intra-agency coordination and communication and collaboration, which in reality could be another form of integrated health challenges. It takes resources and funding to be able to carry out this aspect of SUD service delivery. And then, of course, we have the complicated system of delivering care for SUD, which includes the different privacy laws within different states. And in Texas, we have our own privacy laws, but of course, it does impact it. And of course, finally, transportation barriers and social determinants of health barriers. It's not just about delivering care, it's also about being able to engage the members to come and receive the care we're providing. So how do we address these challenges? Funding. Having the money to expand, to do outreach, to engage staff and engage the members. So let's go to the next slides and we'll talk about sustainability of a substance use disorder program. And then further down the line, we'll talk about the traditional and non-traditional funding methods. So when we talk about sustainability of a substance use program, what are we really talking about? What are we really looking at the level and the extent and the growth of the substance use program across the country, not just in Texas? The need for our SUD programs to grow is rapid. And as a result of that, we need to continue to grow our intra-agency collaborations with other agencies. Our treatment models needs to be diverse and become more integrated with mental health and other physical health modalities and care delivery to the extent possible. Advocacy groups, ensuring that we are engaging more with advocacy groups, even outside of substance use programs and substance use associations, to help understand the significance of substance use disorders. Most of the substance use disorders do have a mental health component. So ensuring that people, advocacy groups really advocating from that integrated perspective of talking about both substance use and mental health simultaneously, not just talking about mental health. And then about the policies, how are we talking to our lawmakers to help enforce policies that will help us sustain and expand our SUD programs? And then funding. We can never talk too much about funding. So when it comes to the funding, how can we expand our funding to ensure sustainability of the programs we've already created or the programs we're trying to create? And that's what the rest of this discussion presentation will focus on, is on the funding part of it. And then, of course, we'll talk a little bit about financial contracts and financial revenue systems. And next slide. So when it comes to traditional funding strategies, we're all familiar with what you see on the screen. So I'm not going to go in detail describing that. I believe almost everybody on the attending today already knows the different ways to apply for substance use grants. Typically, SAMHSA and HESR are one of the largest grant guarantors for SUD. And then we have the different payment models, value-based payments and shared risk being the most popular. And then we have regular billing and reimbursements, contract negotiation, joint funding from health systems or health plans, and clinical integrated networks to finance substance use programs. But let's dive deeper into the non-traditional methods, which are the ways we really want to garner revenue and ways we're looking into expanding and sustaining our SUD programs. Next slide. So when we look at the non-traditional funding, with a raise of hands, how many of you are familiar with doing events like gala, luncheons, and charity and help to expand your programs? Carly and Andrea, I'm not able to see who raised their hands, so if you could just give me a ballpark of how many hands we raised.
Not a lot.
That's good.
You can also use the reactions menu if you want, but I saw maybe 2 or 3 hands go up.
Okay, that's great. That's what I thought. That's what I thought. Thank you. So what I really mean about this is a strategy I've seen some of my clients use. Most mental health and substance use disorder programs out there are nonprofit, especially if you receive Medicaid funding. So what that means is a lot of them would come together, create a program, and then once or twice a year, they would have an event. The event could be called a gala. It could be called a luncheon. It could be a charity event, whatever or however the organization chooses to describe this. They typically will have this in a venue that's different from the administrative office, typically maybe in a clubhouse or in a well-established hotel, which in most cases is donated as a charity donation by these organizations. And you have tables and food being served while you have different presentations to give an update about what the organization does. So for these events, one of the targets that I've seen my clients use is they typically would come in and invite their vendors. How many of you have EHR vendors or technology vendors? They're quite expensive. You have attorneys, they're quite expensive. This is where you get a return for your money. You invite them to buy a table. I have seen people buy a table for some of these events as much as $20,000. They'll have 6, 7 people at their table. They will in turn invite their other clients to join them at the table. So if you have a table of, say, 7 people or 8 people, let's assume 8 people at the table that was purchased for $20,000. These people come to the event, they have lunch, which is typically sponsored or donated by another organization if you can negotiate or solicit well. And then those 8 people, at the end of the day, when you tell them what your programs are, you give testimonials about the outreaches you've done, your success stories, and then discuss your areas of challenges and where you would like to expand, and then, ask for donations. Those 8 people, you can ask for donations however you see fit. You could ask for monthly donations. Some people have by monthly donations. Some people have one-time donations. So a $20,000 table, 8 people sitting at the table, you may be able to get anything from $100 to $5,000 donations from people attended just at that table. And if you end up having about 40 tables in there, you may be able to garner close to $500,000 just from that event. I've seen some of my clients, be able to make up to $500,000. I've seen some of my clients only make $50,000. It just depends on how you plan your event and how you, the cost of the tables and the people you invite. So typically planning these gala events, I've also seen a gala event be done on a weekend where you can bring your spouse, you can have people invite people who have nothing to do with the substance use disorder programs, but rather are invited as family and friends, which even helps further. You have live music, food, you talk about your programs, and then you have a more diverse group coming, not just your vendors, come in and they can all donate. You also want to invite people within the substance use community because they understand your pain. You attend your gala, they attend your gala, you donate to each other. This really does help raise funds. In these galas, I've also seen people do raffles. So if you call some of the hotels in Las Vegas, for example, or some of the restaurants around here or vacation rentals and ask for donations for a charity event or for a good cause, most of them have it already documented and planned for, and they will donate, and then you can go ahead and raffle it at those events. Those also helps to generate funds. A lot of times when you do when you look at these different processes, it helps to generate money to supplement some of the funding and the revenue source that we have for our substance use programs. I've also seen people sell individual tickets. So if you can't afford to buy a table, then can you buy a ticket for $500? So can you buy a ticket for $200? How much can you buy a ticket? It does help. So you have tables you sell, and then if you have tables you're unable to sell, because it's maybe too expensive or people can't afford it, you can reach out to your individual communities and have people buy tickets to attend. And then you can also ask for community donations even at the events. What do the people within the community that you've invited want to donate? I've seen a car dealership donate a car, right? The agency didn't need the car, but they donated the car. The dealership ended up selling the car and giving them the funds. So being able to strategize in these different areas really helps a lot. Let's go to the next slide. And then there are other ways you can do this. Continuously evaluating your vendors is a very helpful way. I used to work for an EHR company. I was the COO for a while, VP of operations for a while. And one of the biggest things I saw where people would buy licenses they never use. So patient portal was probably one of the common ones. I've seen people buy 50,000 licenses, paying almost 100,000 or so and never use it. Maybe they have 10 patients use it. Nobody else is using the licenses, or patients use the license once every 12 months when they come in, or 2-3 times a year. But yet the EHR technology companies are getting paid for this. So evaluating the use and renegotiating, shopping around and coming back and saying, hey, this vendor offered me a cheaper price, can you match it? These are all ways where you can diversify your revenue. And then hire a generation manager whose role is to help you plan this event, solicit donations, plan year-long sales events for raffles. I've seen organizations do year-long raffles. I used to attend a baseball event back in the day in Arizona when I lived in Arizona, and I purchased it from my organization at $6 because we got baseball ticket donations, and then the organization sold it to us at $6, very cheap. So when during the baseball season, I would go see baseball, would go watch baseball. I wasn't a fan, but it was cheap, so I bought it. So you can do this types of solicitation in order to increase your revenue. Let's go to the next slide. And then there are other ways you can diversify your revenue. You can decide to become a CEU organization where you actually create your CEUs and then sell them to your employees or other organizations, or even outside your organizations to bigger organizations. You can contract with, I don't want to mention names, but you can contract with well-known organizations who are known to provide CEUs. You can sell your CEUs to them and use that as a form of your current revenue. You can also organize webinars and conferences for a cheaper rate and have people pay for them. You can invest in CDs and bonds. And of course, anything you do, remember workforce, making sure that the staff are paid well is a necessary way to keep your funding going. Retention really does save on revenue, income, and funding. Next slide. I believe this should be the last one. And this concludes my presentation. I do want to make sure I'm right on time. So I'll hand it over to you, Andrea.
Perfectly on time. Thank you so much for that conversation and presentation. I really, really appreciate you encouraging groups to think outside the box when it comes to funding streams. Any questions from the learning group? Or if anyone has their own kind of innovative funding stream they've identified they'd like to share.
No, I was just gonna say, these are some great ideas. I just sent a text to my coworker because we're in different places. These are really neat ideas that we hadn't thought of, I don't think.
And to the question
you
in the
for those.
chat, yeah, we'll make the slides available after the session. I think you get them in a post-session email. And Leslie raises a question for the group too. Has anybody tried any of these strategies before, especially the non-traditional ones?
When I was with Oxford, we had, but not where I work now.
Yeah, and I'll chime in really quick. I do think it's always good to hear these things. And Carrie, like you said, like try to start brainstorming, like what have we done? What we haven't done? And even considering maybe you might not be at a place to do some of the galas yet, but what would a luncheon or a movie sponsored or any other piece look like? We've had in a lot of our rural areas, we've had like smaller organizations, especially organizations that like veterans organizations that actually have come out and said, hey, we do this on Friday nights. And it's usually a like dancing, and sometimes they have alcohol, which, obviously that's probably a concern in a lot of ways, right? But they'll have these little small events, and then they donate all the profits or a percentage of the profits to organizations. And they do that every single weekend. And so we got on with some of those. Also places we didn't have in some of my rural areas, we don't have larger restaurants, but we might have one restaurant, and just having a night where we get 10% of the funds, we'd make a few thousand. So it's really interesting that people don't realize our weekends, that just small little things, getting on to like when Amazon Smiles was going for a period of time, the grocery stores will have these, you put in your phone number and you get discounts. Well, all those discounts, all the money from that gets actually donated to all nonprofits that are local. You just have to sign up and say, I want my nonprofit to be that. But then you have to get people to like pick yours as the nonprofit. But one of my nonprofits, we don't get a lot of money, but we get about $100 a month. So some months are only $80, but all of those things are helpful, right? They're not a large amounts, but they are helpful. And then in most states, the radio stations, NPR is located in all of our United States, and they do things like car donations, all that, and they'll actually pick a sponsor and they'll donate part of the money to that. And so depending on who you connect with, and again, even though they might not be in your area, they decide on who to pick with that. So just considering those things, as well as the large hospitals, we would get donations from our charity hospitals, Catholic Charities, so forth. Every couple of years, they donate a very specific amount. So that was always helpful too. I'll defer. Chris, you want to go ahead?
Great, thank you. So Christopher Velasquez, I lead Mobile Health Concepts here in San Antonio, Texas. So I will say my experience with several of my clients, their most profitable is golf tournaments. Yeah, I just went through one on Monday here in San Antonio, and I just facilitate the relationships and all that. I don't, but they I think their revenue was 65,000 for a one-day event. That was probably the most impressive number I've seen. Usually it's about 25 to 35,000 profit for golf tournaments. And you think of corporate America, everybody plays golf, everybody likes to go out there and have some drinks with their buddies and all this other stuff, and it's a 501c3, so everything's tax deductible. They have different corporate level sponsorships, but this is their 5th year doing that, and they do very well. So just kind of food for thought. Cater to the people that have the money and are willing to give it out. So even if you do partner with some local corporations, I would highly recommend, rather than just them writing you a check for $5,000, maybe collaborate with them to help sponsor or sponsor the tournament, or help sponsor the tournament, and that $5,000 will go a lot further with collaboration for a larger grab of money. So just kind of food for thought.
And I want to piggyback on what Chris said. If you're a small organization, especially if you're rural and you're thinking, oh, we could never pull that off, we don't have enough staff even to cover what we're doing, you could partner with other organizations and actually create more of that collaboration that you really want anyway for those referrals that you're hoping to get. And so maybe pull together maybe one of these events or some of these ideas, and it might not feel like it fits your community, but you could retrofit it to your community, especially if it's, if a different type of activity is more of what people are excited about.
I would also add to that some of the payers that we're all familiar with also have a charity donation that they actually put in their budget every year, but you have to reach out to them and ask. Most of this budget gets created between August and October. So if you're reaching out in January asking, they would typically say no. But if you ask to be on their charity list, they typically have a standard amount they will donate. In some cases, they want to see an event associated with it. In some cases, they don't. So they typically will walk you through that. Some of them have you register beforehand. Some of them just have you send the information to them. But a lot of the health plans also have a charity list for donations.
Yeah, and I was gonna say, I know Walmart, the individual locations, the big Walmart, of course, you can apply for a grant, but each individual location, you can go to that manager and apply for, it's got a certain name. And they donate anywhere from $250, I think, to $1,500 for an event. And that you can walk in and actually apply for with whoever that particular manager is with your documentation. Each individual location, not the city as a whole. Because we've done that in Oxford, and we've also done it locally with the shelter I used to work with.
Yeah, I agree. You can do that with a lot of these places that will host the luncheons for you. Go into a well-known restaurant, ask for their meeting rooms, and see if they can donate it for a good cause. Most of them will do that. So yes, I agree.
Yeah, Chris, coming back to you.
Sorry, I'm trying to eat lunch here. And going to your point, Carrie, Walmart. So here, I don't know where Oxford is, I apologize, but in San Antonio, there's a recent rule change. So now, because you are correct, it used to be like that. You can go into any Walmart and you can hit 10 in the city of San Antonio, and each manager could commit a certain amount of money. That rule was changed recently, actually the first of this year. That was a change here in San Antonio. I don't know if it's nationwide, but Costco used to do the same thing, and they also went, you have to go actually to their website, file for a, corporate sponsorship, all that other stuff. So it used to be nice, right? When the managers had the autonomy to just go ahead and give you some money, but it was a rule change here in San Antonio. I don't know this nationwide. I didn't
Oh,
ask.
if it's Walmart, it's nationwide.
Okay.
That's how I used to work for Walmart. If they change
Okay.
it in one, they change them in all. But that's good
There
to
you
know
go.
because I didn't know. We haven't done it. I
Well,
haven't.
I recently tried for one of my clients here in San Antonio, trying to fundraise for him, and that was the rule last year. This year it's changed, so just FYI.
Well, hey, thanks for the late breaking news. That's really good. Good to know. Thanks, Chris, for sharing. Rocky, I have one
Yeah,
more
thank you.
question. Yeah. One more question for you. If you're brand new to approaching these kinds of relationships and reaching out to find partners, you mentioned sort of going up to them and saying, would you like to be a part of a good cause? Are there certain details or descriptions of your organization that you feel are really compelling when you're seeking partnerships? Like, what should you describe about your organization to get somebody interested in partnering for, let's say, a fundraising event?
I would say your mission statement. What is your mission statement? That's your first priority on what that is. What are you doing? What is it for? But what are you doing as an organization? Because that's a vital part of what we've done when we went out. Because every year, I'm still alumni with Oxford House. We do Thanksgiving and recovery, and we do approach people, but we have our mission statement, what the funds would utilize and be for.
Yes. And I will add to that, your mission, your vision statements, you want to talk about the goals you're trying to achieve with the funds, and then the challenges you currently have because you don't have the funds, and then testimonials from people your organization have helped. That gives them a real humanistic picture of why the funds are necessary. I would say, yeah, most of the ones I've attended always typically follow this format. And for the clients I've worked with, most of them go in with that process. And you want to make it concise and fast because, there's a lot of people applying. So, and then in some cases, a lot of people have brochures created with all of this. So there's a brochure, there's a video associated with it, especially with the testimonials. And even at the event, you want to bring 1 or 2 people to give a live testimonials about the success of them engaging in your organization has brought into their lives.
Terrific. Thank you.
Your point, and
go ahead, Chris.
I'm sorry, Andrea. Yeah, to that point, I don't know if you're just asking general or you're asking specifically the presenter, but to that point, you're gonna, I've been raising funds for these organizations for a very long time. And the easiest, the old adage, and it used to be the quickest way to a man's heart is through his stomach. Trust me, the quickest way to anybody's heart is their stomach. So I will get, because they know that you're there to ask for money. They know that. But when you get the door slammed on you, or they're like, no thanks, but no thanks, I either have 1 or 2 things, and it's very low cost and very high effective. Either have a Starbucks cart delivered of coffee for their team, and don't even go, just have it delivered. Put your card on there, whatever, just say, hey, I just sent some coffee to your team. Thank you for the opportunity. Or in San Antonio, tacos. $20 worth of tacos will get you so many kinds of leeway. I mean, it will get you some progress. And it's really, honestly, don't ever ignore the lower administrative people that are there at the organization, because they are the ones that are gonna get you on that schedule. So even if you have this real quiet, young person answering the phone that is not really, given much attention to, if you cater to that person and give them the tacos, give them the coffee, get one nice Starbucks gift card, whatever. Trust me, those little things I've spent maybe $50-$60 and got over hundreds of thousands of dollars in grants and stuff. So it just it's just the way it works. But anyway, just food for thought.
Love it. Love the regional specific recommendation too of tacos. Well, if more ideas come up, everybody, that's what the chat's for. Feel free to throw those ideas and those questions in there. I want to make sure we leave time for our case presentation. So I'm going to jump to some announcement from the CSAT team, and then Rita will come to you for the next part of our session. Carly, if you could share those slides. All right, so the Center for Substance Use Training and Telementoring, or CSTAT, provides high quality education and best practices for responding to substance use. CSTAT can help enhance professionals' knowledge and self-efficacy to screen, treat, and make referrals for people with substance use disorders Learn more, visit their website at c-stat.ethscsa.edu. That was very fast, so we'll pull it in the chat too. Next slide. A really important announcement. This matters for each and every one of us, for addiction specialists and healthcare professionals. Narcan is now approved for over-the-counter sales. So be on the lookout for more information about the new guidelines in one of our upcoming sessions. Next slide. And also, as you may remember, the new Consolidated Appropriations Act has removed the X waiver requirement, and the upcoming MATE Act will require prescribers to complete 8 hours of opioid use disorder and substance use disorder training upon renewing or receiving their DEA license. So to get updates and learn more, visit that CSTAT website I mentioned earlier. There's lots of resources and people you can talk to if you're having trouble navigating this space. Next slide. And just a reminder, to claim your CME credit, you need to text this number by midnight. So text attend, and then the code 100928. Oh gosh, sorry, I always read this wrong. 92869 to the number you see here on the screen. We'll put this information over in the chat. Again, you need to text attend to that number by midnight tonight. Just so you know, you don't want to enter any spaces in between the digits when you text it in. Next slide. And you all should have received a Zoom email from Be Well Texas letting you know that this ECHO series has been updated. Make sure that you navigate to that email and download the new calendar invite so that it appears on your calendar for the next, I think it was scheduled out for a whole nother year. We don't want you to miss a session. If you're having any concerns, any questions about that, just reach out to the CSTAT team and they'll be happy to send you a new registration link. And next slide. I hope you'll join us for our next month's session. That's going to be on May 25th. And we'll be hearing from Dr. Erin Finley about adapting evidence-based practices to fit your setting. Really excited for that presentation, and I hope you can join us. Okay, can stop the screen share. Rita, you're our case presenter for today, and we're going to take a different approach. Instead of sharing a case form today, we thought we'd like to just hear more from you. Tell us more about the organization, the successes and the challenge, the points of pain, and any questions you have for this learning community. When you're ready.
I'm ready. As I said, I'm an RN case manager working in permanent supportive housing. Foundation Communities built its first permanent supportive housing community in 2004. When I joined the organization in 2016, we had just added our 5th community. There have been 2 more added since then, and we will be bringing 2 more online this summer for a total of 9 permanent supportive housing communities. So that's about 1,200 people total. I was brought on to the organization to really address the tremendous need we were seeing when people were coming into our housing for medical care. People who'd come out of homelessness had very, very extensive unaddressed medical needs and coexisting substance use disorder and mental health needs as well. So we've had, as a team, really tremendous success in addressing those medical needs. And I feel like those successes are really firmly rooted in our relationships with our local FQHCs and the providers and their willingness to really collaborate with us. And as our presenter said, as some of the barriers to working with substance use providers in the community, that lack of interagency coordination and communication, that's really significant for us in our work, and feels like a really tremendous obstacle for us having the same sort of successes on those fronts that we've had in the medical community. That's despite, having all of the proper ROIs and having established relationships with certain providers. So I'm really eager to hear, from this community, how do we improve those relationships so that when someone does go into treatment, maybe we'll see a care plan when they come back. Maybe we'll know, like, my gosh, what medication was prescribed to them? Where do we pick up that care and help them sustain it so that it's not this piecemeal treatment that doesn't really result in any improvements or just quality of life overall. We have a lot of people who may end up losing housing, unfortunately, because of things going awry on the substance use front and with their mental health. And it's, of course, the last thing that we want to have happen. So thoughts on how we coordinate and communicate with providers that would result in better outcomes for our residents. Tacos? Do I need to bring tacos?
How close are you to saying no? I couldn't have asked it better myself. I think Rita frames the question nicely for the audience, and I think we'll leave it to you all. Any thoughts, any questions for Rita, first of all, or feedback on the challenges she's presented? Lindsay, I don't know if I saw your hand pop up, but I wasn't sure.
Yeah. So I think, from a peer perspective, right? A lot of the individuals that I work with, and I also used to work out at like Community First Village for many years, and they have the kind of same issues, but it really it boils down to the fact that the residents didn't want that information shared, and so that from our perspective was not. Even if we have an ROI, that doesn't mean we have to share. That means we can. And from a peer's perspective, like I said, that's always left up to the participant. And it's just a lot of them are afraid they're going to lose their housing. They're afraid if they discuss this, that they're going to have repercussions, So I think that it's really about developing the relationship, maybe, and maybe meeting with the person and, and maybe if they have a peer, like meeting with them and their peer, and really just showing them and explaining them that they're not going to have any of those repercussions, right? Or they're not going to no retaliation. I think it's fear. And I mean, I would be scared too of losing my housing, right?
We've definitely encountered that, but conversely, we've had folks that come to us because we're there, we work where they live, and come to us for help after coming out of treatment and just not knowing where to pick up where they left off once they left treatment. And that's the pain. Yeah.
Rita, I have a question.
Yes.
Are you aware of policies of these organizations that may actually, even though you have agreements in place, may require additional steps or things that need to happen to exchange or to actually then do that sort of warm handoff that I think Lindsay's talking about?
Yeah.
So maybe trying to understand what those barriers might be internally from the organization.
We've made some efforts on those fronts. For sure. I think sometimes changes in staff at the organizations really leave us a bit hamstrung on that front, may have those conversations with people and then not being able to connect with them again. It doesn't always seem to translate across the organization as a policy, but I hear you. I think it will require some real effort at developing those relationships. And as you said, finding out what the specific policies are.
So I think for me, the easiest way that I thought about that I get around those policies and stuff is just to have the person call with, to be with them and have them make the call, because then you don't have to worry about any of that, right?
That is helpful for sure. When we do have that cooperation, or the person is in a state where that's possible. And that is frequently not the case. as I'm sure you know. So more ideas.
This is Leslie. Have you had collaborative meetings already at those organizations? Like met with their leaders, administrators, and what was the outcomes of that?
We have not, and that is, yeah.
Yeah, that
Leslie,
might be a good start, because then you could explore those questions, right?
Mhm.
Related to policies, procedures, but then also be very, truthful of, here's our quandary, right? We
Mhm.
have patients, we both want to help. Here's where we at. What are your thoughts related to brainstorming the best ways we can ensure that this patient is getting the best amount of help in our community, and really come from it from that perspective. And they might be able to figure out workflows, different types of contracting with you, different types of paperwork,
Mhm.
different types of sharing of information, things like that.
That's helpful. Thank you.
Just because I'm probably a little naive, but you said it's not always possible to call with the person. Is there a reason?
The person might be too affected by their substance use disorder to make that call. Yeah, that's a big barrier when you're trying to help someone who's actively in the throes of their use. Yeah.
I think that's particularly a great time to bring in like a peer provider, right? Because we can kind of approach the situation from maybe a little bit different, and really like we've been there, and can often kind of bridge that gap. And we have the time, right? So that's part of it, is that most of us are allowed to meet with people as often as we want, as long as we want, which is very helpful, I think, when working with somebody like that.
I agree. Our one of the two communities that's coming online will have a dedicated peer as a staff member. Right now, our peer divides their time between 4 or 5 different properties, which is really difficult to have those meetings with folks and make those calls like you're saying. But I think in that future situation where you have a dedicated staff member, we may see some improvements around this for sure. Yeah. Any other thoughts?
I have another question.
Yes,
When
ma'am.
you said you're measuring the outcomes, I know it's easier with physical health, indicators like that. What are your metrics to measure the success for your SUD and mental health?
A lot of them pertain to their actual housing, being able to retain housing, being able to maintain their environment, not being disruptive to the community. Those are things that the challenges that we face pretty regularly, just in terms of like cleanliness and clutter and their own safety and the safety of others. Yeah.
I wonder if a lunch and learn at some of the these, even at FQHC, because I know that when I've worked at FQHCs before, educating the staff, not just your care coordinators and case managers, but also anyone who can, get CUs for these, to come in and talk about the benefits of that particular aspect of someone's life that will actually increase the health outcomes that they are responsible for and their reimbursement. So in other words, mutual benefits between, but also how environment affects health, because not everyone learns that in their training. And it's always good to remind them, especially with unhoused or, folks who have insecure, any type of environment.
That is a very good point. Thank you. Yes.
While we're sneaking up on time, I just want to open the floor. Any other feedback, suggestions, strategies you all have found that have worked for kind of improving those relationships with local providers that we can share with Rita.
Okay. Well, thank you all so much for your time and your input.
Absolutely. Yeah, Kathy, go ahead.
Oh, I just wanted to tell her good luck with her work. Absolutely.
Thank you.
Yeah.
Thank you so much.
Yeah.
It's very lovely work. It's very gratifying.
Well, I think we're
Great
coming up.
presentation.
Oh, thanks.
Thank you.
All right. Well, we're coming up on the end of our hour. Kathy, I wonder if you might overview some of the key points from our discussion today and just kind of summarize the recommendations for Rita.
Okay, so just a quick overview of the didactics. Just understanding that funding and sustainability is difficult for substance use disorder programming of all kinds. And I think Rita definitely extended that too, with how you even get those relationships. And so our presenter really gave us some great creative ideas about events that could generate not just contributions and donations, but attention, and also educate the community about the organization and sort of draw in those partnerships that could be really helpful later. And that would include, everything from galas to golf tournaments, when we had that as a suggestion, CEUs providing those, and even investing that money. Then looking at some of the payers who have some charity funding and making sure that you understand what your community is contributing to and who does those types of things, and a lot of networking together. And then we got some really great tips on when you do make that ask, make sure that you have your mission statement, your focus, and also specific goals for the funding that you're asking for. Then moving to our case, Rita talked a lot about the benefits of partnering when you are looking at someone's whole person care, and the challenges that her organization are facing, that lack of interagency collaboration, even when you have agreements. And so some of the recommendations were to start getting to get to know the peers who are maybe facilitating that discharge if they are inpatient or if they're in a facility, if they're under care, understanding the agreements that you have within your agencies, and getting to know the leadership and explaining what your goals are and what benefits you can provide the patients for their outcomes, and then also providing some education around the mutual benefit for the patients and the agencies to have these relationships, and addressing all of the needs of a patient.
Terrific. Thank you so much. I'll open it up if anybody has any last thoughts for Rita. I think it's a challenge shared by many, Rita, and we appreciate your honesty in bringing it to the group today. And thank all of you for the great feedback and the great discussion today. I don't want anybody to miss it. The last thing in your chat are those instructions for getting CME credits. So make sure you text that number to get your CME credits by midnight tonight. We hope to see you at our next session in May. Again, check your email. You should have gotten an email from Be Well Texas about extending this series. Re-download or download that new calendar invite to make sure you know where to show up in the coming weeks, or in the coming months, excuse me. Thanks to our didactic presenter, Dr. Komolafe, for the great presentation. Rita, thank you for bringing this case to us. And thank all of you for joining us and continuing to support this community of learning. Have a wonderful rest of your week.